lift up issues of injustice and work for justice here in the state of Ohio. And this certainly, Medicaid expansion, is a justice issue and a faith issue. We have been hearing the faith voice in Ohio on this issue for quite some time now. We've been part of press conferences like this and gatherings around the Statehouse. We've been talking to coalitions across the state representing a wide variety of people here in the state of Ohio. And I want to say the faith voice isn't a church speaking. The faith voice isn't a pastor speaking. The faith voice is the people speaking. And that's what we've been hearing. We heard it, I think, clearly this past week from our own governor, Governor Kasich, speak about how his faith informs him on this particular issue of Medicaid expansion, how it has compelled him to work diligently on this issue for all Ohioans. I do believe that the governor sees this as more than just a political issue or a budgetary issue, although those are part of all of this. He sees this as a faith and conscience issue. He has worked together with members of both parties and with people of a variety of coalitions representing the vast diversity of people in our state. He, along with legislators in both parties, agree that Ohio cannot leave those who are most vulnerable to access to health care in the state they're in. That we need to open the Medicaid rolls through this expansion so that others who have not had that access to health care can receive it. 275,000 people estimated will benefit from this expansion. I think Governor Kasich has demonstrated that he believes, and this was the title to the article in the newspaper, that God wants Ohio to pass Medicaid expansion. Well, you know what? I think God wants us to want Medicaid expansion passed and adopted in this state. I would dare say that God wants us to do that, to be a part of it. God isn't just out there somewhere miraculously going to make it happen. It takes us, the people of the state of Ohio, it takes our legislators working together, bipartisan, to make this happen. So what does the faith voice look like? There's a song, as you heard, I might sing, and I like the acoustics here, so maybe I will. It's called We Are Called. The word for called is the same word as voice. Vocation comes from the word called. So maybe rather than saying the faith voice, maybe we should be talking about how we're all called to work on behalf of those who don't have health care coverage here in our state. We are called. Here are the words to the refrain. It goes like this. We are called to act with justice. We are called to love tenderly. We are called to serve one another, to walk humbly with God. That's the faith voice. Those words, paraphrased from Micah, remind us that the faith voice is a voice that cries out for justice. We cry out for our legislators to work together in bipartisan leadership to pass Medicaid expansion now, so that the earlier it gets passed, the more people in this state will benefit from that passage. This is a justice issue. The faith voice is a voice that responds to those in need. Not so that we can get to heaven, or not so that we get a pat on the back from God. No, we respond to those in need because we have compassion. We have love. All of our faith traditions tell of healing stories that are motivated not so somebody gets something, but out of compassion and love. The faith voice is a voice not to protect what is mine, but that we might be in service to all. The voice of faith recognizes that we as a state, nation, and world are healthier when our neighbors are healthy in mind, body, and spirit. The parable of the Good Samaritan recognizes that fact. The one least likely to assist the one there on the roadside
who is in trouble helping him, knows that in the back of his mind, I'm sure, if he ever befalls that trouble, he hopes a neighbor is there for him. We are the neighbors. Our legislators are neighbors in this state. So we do this not to get a pat on the back from whoever it is or whatever it is we believe in. No, we do it because that one that we believe in compels us with compassion to reach out to those who are most vulnerable. Finally, the faith voice speaks humbly, knowing that we may not have all the answers, knowing that we may not always agree on everything and how things should be done, but we don't let that stop us. We don't let that stop the power that can be generated to make changes in our community for the health of all people, and especially the most vulnerable among us. We no longer need to let the voice of difference and division keep us from acting, but even in the midst of those differences, we can act with justice, love, and peace. Ohio cannot afford to use anecdotal stories of abuse of a system to keep us from providing health care to those in need. We can, however, encourage those who are working together in a bipartisan way to reform Medicaid so that abuse and misuse doesn't happen. We also need to see that the passage of Medicaid expansion will help Ohioans to lead healthier, more productive lives, which in the end benefits all of Ohio. Our faith should compel us to act on our moral voice and conscience. We urge all Ohioans as people of faith, of people who are called, and our elected officials to support Medicaid expansion, to get it done as quickly as possible so we can receive its benefits as an act of faith, justice, and compassion for our neighbors. I invite you to sing with me if you'd like to. We are called to act with justice. We are called